in my head.
Wish that I was on old Rocky Top down in the Tennessee hills. Ain't no smoggy smoke on Rocky Top, ain't no telephone bill. Once I had a girl on Rocky Top, half man, the other half cat. While as I make but sweet ass soda pop, I still dream about that. Rocky Top, you'll always be home sweet home to me. Good old Rocky Top, Tennessee. Rocky Top, Tennessee. Once two strangers climbed old Rocky Top, looking for a moonshine still. Strangers ain't come down from Rocky Top, reckon they never will.
Hello, everybody. Good afternoon. My name is Jordan Pruitt. I work in the Office of Alumni Affairs as the Assistant Director of Special Events and Programs. I'm so excited today that we are going to be joined by some really excellent experts in self-care and healthy relationships. I'm going to get us started with going over just a few ground rules first, and then we will get into our content for today. So starting off here off the bat, just notice that your mic has been muted and will be muted for the duration of the presentation today. This is just to avoid any disruption for our presenters. However, we do encourage that you ask questions. We are excited to see what you all have for our experts today, and they are eager to see what you have as well. So on the webinar, you will see the Q&A feature. Please use that throughout the duration of the entire webinar. And then at the end of the webinar, Amy and myself will come back on screen and facilitate those questions with our panelists. So before we get going, we are going to do some brief introductions, and I am going to toss it over to Dr. Amy Rauer, who is our moderator for today. And I am going to go away. I'll be back at the end to facilitate those questions. But Amy, I'm putting the ball in your court, and I will turn it over to you from here.
Thank you very much, Jordan. And I just want to say thank you to the UT Alumni Center for putting this together and for giving us the opportunity to get together and talk about relationships during this time. And so Jordan said he's putting the ball in my court, and I'm immediately going to toss it to the wonderful Dr. Gordon to introduce herself and tell us a little bit about what department she's from and what she is interested in studying.
So hi, I'm Christy Gordon. I'm a professor in the clinical psychology program in the College of Arts and Sciences. And I would say that I started out studying the dark underbelly of marriage. So I was searching infidelity, intimate partner violence, major betrayals, and really what we sort of termed relationship traumas. And I also have a small private practice where I specialize in helping couples with those issues. But as I'm working with couples and learning about all this stuff, it became really clear to me that so many of these things could be prevented if we could just reach couples earlier and reach more couples. So really what my research is about right now is trying to develop brief, accessible interventions for couples, often that can come alongside standard health interventions and slip in some communication skills and try to make this kind of important, empirically supported interventions that we have out there in the community and useful to all kinds of people.
Fantastic. So Dr. Cantor, do you want to follow up?
Absolutely. I'm Jeremy Cantor. I'm an assistant professor in the Department of Child and Family Studies. My research primarily focuses on understanding how relationships change across the life course, particularly what factors lead to more stability in relationship functioning and what factors lead to more distress. In particular, my recent work focuses on lower income families and how they navigate adversities, specifically financial stressors. And a lot of my recent work has focused on similarly intervention work with couples, what interventions might be more effective for couples. And then also, and I'll touch on this today, we launched a study of understanding how couples are functioning during COVID. So I'll bring some of the initial findings we have here today. I'll talk about that as well.
So you'll get to hear it here first. So this is groundbreaking study.
Exactly.
Oh, Dr. Roberson, do you mind introducing yourself?
Of course. My name is Patricia Robertson. I am an assistant professor in the College of Nursing. My research focuses on marital and family relationships and health outcomes, particularly for rural and underserved communities. Right now, a lot of my research focuses on family functioning and marital functioning and how that's linked to diabetes management, and also patient and caregiver relationships for breast cancer patients, particularly in the first year of breast cancer treatment. So I do a lot of research in hospitals and try to engage telehealth, but also a lot of what I do is what's called public facing research. So I try to get research out in the public domain, whether it's mine or not. And one of the main ways I do that is with a podcast called Attached, where every episode we talk about a recent research article. We try to break it down and give people some nice takeaways, but also we try to scour the internet for relationship advice out there, which there is a lot of it. And a lot of it actually isn't that fantastic. So we use the science from all of these wonderful scholars here, but also people all across the country to either support or debunk some of that bad relationship advice that's out there.
So she's setting the standard high for us. We'll do our best to ensure that the advice we give you today is going to be excellent and won't end up on her next Attached podcast.
Right.
But just to introduce myself briefly, my name is Dr. Amy Rauer. I'm an associate professor in the Department of Child and Family Studies in the College of Education, Health, and Human Sciences. And my interest is in how individuals grow within the relationships as they change over the life course. And as I've studied couples over the life course, I've started to really focus on how couples start to take care of each other later in life. But I'm also really interested in the fact that a couple represents only one of the key relationships we have in our lives, and that we need to think about how couples are embedded in many more relationships that affect us. And I'll bring this up again later, just as Dr. Cantor mentioned, he'd be bringing up something later, that I think a lot of what we're seeing with the pandemic is the importance of not only the relationship we have with an intimate partner, but the relationship we have with everyone else as well. So to get us running into today's topic, because we were privy to some wonderful questions that have already been submitted to us, and we're going to kind of use these as a launching pad. But again, please feel free to use the Q&A button, and we will be able to address those questions towards the end. But we're going to start off with a fun one. I think all of us can perhaps relate to this one, so it might be why I particularly wanted to pick this one. So the first question I'm going to pose to the panel is, what advice can you give to a couple that is now working from home together and therefore is spending more amount of time together than before? Who would like to take that one? Whose spouse is not in the room and therefore they feel comfortable answering that one?
Yeah, I have my white noise on, so I don't think my husband can hear. So maybe I. No, I think, and Jeremy, you're probably going to talk about this later when you talk about your study, but the few studies that seem to be coming out suggest that folks that were doing well tend to be doing better as we go through COVID, because they're kind of making good use of this time, and people who weren't doing so well are struggling. And so one of the things I would say is maybe twofold. Is one is finding some way to get some space, to give each other some space and grace. Taking breaks from each other, taking some time to step back and get perspective. And also, we're under a lot of stress, and stress really does not do great things for relationships typically. And so we need to realize that we need to give ourselves a lot of the benefit of the doubt and some kind of time to cool down and not to speak without really considering what you're saying. And then the other thing I would say would be really important is also just the act of listening, and how important it is to really listen to your partner with a curious mindset. Listen to understand, not listening to respond, is a great kind of phrase that I've heard and really appreciate, to really try to understand each other's point of view and to give each other that kind of emotional space as well.
I think also building on that, kind of what Amy was alluding to, is we are likely stuck in a home with our spouse, but that's not the only relationship that is critical to our mental and physical health, right? Some of us have adult children, some of us have young children, but we also have friends and siblings. So even though we might be encouraged to be physically distant from other people, not ensuring that also means socially distant from other people, right? Emotionally and socially. We have phones, a lot of us, we have video chat. So not relying solely on our spouse or partner to be that kind of emotional reprieve from the stress we have. We can also engage with all of our other social connections as well. Will be really critical to help us get through this stress and building on what Christy was saying, acknowledging that stress, it's not just you, it's like we all are feeling it. It's a universal thing right now. Oftentimes helps us feel less isolated, knowing that we're not the only ones feeling that, I think is a really important thing to just remember as well, as we're trying to continue to navigate through this pandemic, or pandemic as the kids are calling it.
Oh God. I hadn't heard that. Thank you.
So kind
Keeping
of
you guys all really, really hip. That's my role.
kind of jumping on that as well and talking about the fact that for a lot of couples, there's this kind of double-edged sword, right? So some couples that we've talked to, what's the most stressful thing, or one of the most stressful things within your family right now is spending so much time together. Then we ask them, like, what are things that are beneficial? And a lot of them will say, getting to spend that time together, actually, without the distractions of running around doing, all these different things. And in fact, we found that for a lot of couples, using that time wisely, so talking about some of the things we've talked about, like active listening and being able to communicate effectively during that extra time could really be important. So using that time more proactively in the relationship could be really useful. And then also we talked about like realizing that this is a stressor that everyone is going through. That can be really important when we kind of put meaning towards what our partner is doing, their behaviors. So normally, if a partner is more negative, we might assume, oh, it's because of them, or it's something that's, we blame it on them. But when we know that there's other stressors that are going on, we're more likely to say, well, it's probably because something else external to them, not going on with them specifically. So we kind of divert some of that blame. And that actually helps a lot with alleviating some of that stress and that communication that could be problematic for the relationship.
I'd love to jump. Oh, I'll let Patricia hit that one.
I think building on that, like if you have that time and are able to make meaning out of those kind of times that you have together, oh my gosh, fantastic, do that. But also at the end of the day, if you're so stressed that all you can do is just watch a TV show together, you are winning. Like that's also extremely fantastic. So not every moment has to be meaningful. It's fantastic when they are, and we're not diminishing that at all, but taking time to just de-stress and be with your partner, or not, you can also watch TV separately. That's also fantastic too. I think recognizing what you need to de-stress is also, and you and your partner need together to de-stress is also really important, and making sure you figure out a way to fit that in too.
And I'd actually love to piggyback off that point, because I think what Patricia is so nicely hitting on, and all of our panelists are, is the idea of this notion of time together in couples sometimes gets conflated with the idea that we're going to be talking about our feelings and our relationship. But time together represents quite a few things. And we think about, even if you see in children, they'll do something called parallel play, where they're playing near each other, but not with each other. And sometimes that can be fantastic, and have, scholars such as Art Aaron has talked about finding new novel activities. Now, that's not saying go bungee jumping. That's probably not safe to do under any condition in my mind, but things such as puzzles, getting outside. I mean, we have the benefit here in the Rocky Top that we can continue to do so. And so taking advantage of being physically active together, but togetherness doesn't have to mean that it's all relationship focused, because a lot of times that can be overwhelming and take more of our resources, whereas just having companionship can actually bolster it. So I have to always put in a plug for puzzles. Are just fantastic, because you have a shared goal, and they're usually about $10 if you get, Disney oriented ones, if you have family getting involved also. But it really is about kind of working with adjusted expectations for what you and your partner should be doing.
Yeah.
Absolutely love that. Yep.
Okay, do we want to move on to the next question?
Sure.
Doing fantastic. We're just going to go right through these. Okay. Ooh, they didn't know which one I was going to pick next. Now, let's add another layer onto it, because I think we see a consistent theme in some of the questions. Each relationship looks a little different, but for those who have children, how do you suggest balancing working from home with your partner and children there, and maintaining a healthy time management balance? And I'm going to be listening eagerly to your answers on this one. Who would like to start?
Well, I think, again, acknowledging that it's very stressful, that, we're not going to be the perfect parent. We're not going to be the perfect partner. We're not going to be the perfect worker, while we're trying to simultaneously balance under one roof our partner, our children's homeschooling, and work. That is impossible feeling, not during a pandemic. So some days you're going to be a better parent than you are a worker. Some days you're going to be a better worker than you are a parent. Some days you might feel guilty that your kids are having a lot of screen time. That's
Someday, every day.
Fair. I did underplay that. Like my
You
kid
did,
right now,
very much so. Yeah. But, okay.
my kid currently is doing online school by herself right now. So, there are things that, you're not always going to be great at. But the kids will be okay. We will be okay. One thing I saw on Twitter at the beginning of this is trust the teachers, right? Like they will get your kids through this. And once the pandemic's over, this is what they're trained for. They'll get them back up to where they need to be if they happen to fall behind. So trusting other people that you don't have to take on the mantle of ensuring that all of these things are executed perfectly is something that hopefully will relieve a little bit of stress and set your expectations in a more reasonable way, perhaps.
And I think doing so visibly to the children. I think at the beginning, we were trying to put on a happy face. It's going to be fine. Like we can get through this. And now, we're looking on a year and it's a very different world, and acknowledging these kind of stressors are affecting everybody can normalize the idea of expressing vulnerability and fear rather than saying just, buck up, it'll be fine. We're going to get through this. And so oftentimes children need to hear, I'm struggling too. This is really hard. You know what? Mommy's going to go enjoy, perhaps Bridgerton again and everything, or just pick up the next mystery novel and we'll all read together because I'm struggling too. And I think that is something that oftentimes we treat parents as they're supposed to be kind of the foundation of everything and thus must be steady at all times. But there's a real freedom in letting kids know that it's okay to struggle sometimes.
Right, and modeling that behavior for children, I think, is equally beneficial in terms of parenting than being this like stoic person that can handle anything. I think that's also very important.
And while we're talking about modeling, there's two other things I think that sort of you were getting at, Amy, that we need to model is self-care.
Yes.
It's to be able to take care of themselves, do self-care when they grow up. So we need to model for them mommy unplugging or daddy unplugging at some point to get what they need to come back and to talk about that and say, this is really important. Mom's going to go have her time by herself because she needs that to be a good mom and just to be a good person. And,
or dad. Yeah.
Or dad, exactly. Yeah, I'm speaking for me, but yeah. But I also think we need to model as partners, relationship partners, taking time for your relationship, because when kids grow up to be in relationships of their own, we want them to be doing that as well. And so many times in a big research study that I did earlier with couples, we would run into couples that felt like they had to give all of their energy and attention to their kids, and their relationships fell apart as a result. And that's not good for anybody.
Mm-hmm.
So finding a way, if you have to park your kids in front of a screen for hours longer than you want so that you and your partner get some time to sit down and talk with each other or be with each other or rock climb with each other or ride a bike or do something, or I'm going to just say it, have sex. You guys do need to still have sex. And there are ways to make that happen. There are ways to sneak off and make that happen. And I do encourage that people do that. But I think, again, the theme here is adjust your expectations. This is not going to be like big old gourmet sex that you might have had when you had to get away to a hotel. Maybe it's a little
more about
sex.
this gourmet sex. That's fascinating.
I'd like to see a definition here, operationalization.
The house, there's more of that. But what I'm saying is you're in maintenance mode right now. We're all in maintenance mode.
Mm-hmm.
Adjusting those expectations in the maintenance mode, but also making sure that everybody gets maintained, not just the kids, but and your relationship, I think is really, really important. And if you're the kind of person that feels like you have to be the Uber parent, remind yourself that doing that is part of being the Uber parent, is and modeling self-care and taking care of your relationship.
And I think another thing we talked about like roles, right? Like the individual role and the couple role. One thing that's really important, I think, and we've seen this a lot, and I appreciated the wording of this question of like each relationship is kind of different. And we've seen during the pandemic, couples and individuals and parents have been affected differently. We know that parents in particular, particularly in heterosexual relationships, mothers have had reported the most stress, right? They're the most stressed out. They're a lot of times balancing work, childcare, all these different household responsibilities. And so I think a lot of parents have talked about like what would be really great is having a more equal share of like childcare and household responsibilities. Yes. So kind of outside of even the relationship realm of like communicating or anything of that nature, it's really important for men in particular in heterosexual relationships to be aware of that potential discrepancy and really pick up some of that slack they might not have realized before. But now that both partners are in the home, realizing, oh, there's a lot of things that are getting done that I might have not even thought of or considered how that was happening. So really being aware of that and trying to pick up and reduce some of that discrepancy. And we know from before the pandemic, like that equal share or more equal share is really beneficial to relationships. Like it positively spills over in satisfaction and a bunch of different positive outcomes. So it's really, really important, not only at the individual level and focusing on the couple, but like what are the different roles I'm doing within the house, especially now that I'm kind of in the house for a very long time with a partner.
Well, and just to tie together some points, I believe there was a study that suggested that the more that men in heterosexual marriages were doing housework, the more access they had to the gourmet sex that Dr. Gordon talked about. So
because your partner is not so exhausted.
Exactly.
So this is going to be backwards, but the book is Fair Play. This is a fabulous book for couples to get to help them rebalance their relationships in more equitable ways. To exactly go after the point that Dr. Cavnar is making is that, and what I love is it's not talking about equal, because sometimes you can't have exactly equal roles, but it's equitable roles, going for equitable roles. And it's funny and it's entertaining, and they have a card game that goes with it. So it's a really fantastic book. And I forgot to mention when I introduced myself, but I'm involved with a local organization called Healthy Connections Knoxville, and it's healthyconnectionsknoxville.org is the website. And we've got a Facebook page as well, and we will be doing a Facebook Live on Fair Play in March. So keep your eye out on that. So
I think also kind of building on what Jeremy was saying is there's some real life consequences to this inequity in the pandemic that's coming out. What we're seeing is that women in these heterosexual couples with small children in particular, young children in particular, are actually the ones that are leaving the workforce, are reducing their hours in the workforce to accommodate this addition in household work. Because everybody's at home, there's naturally going to be more chores, but also the homeschooling. And the economic consequences of that are really, really far reaching. It means a much smaller or much lower lifetime earnings, more difficulty getting back into the workforce at similar pay rates. So the consequences of this inequity that we're talking about has substantial long-term economic impact that I think we should be seriously concerned about what's going to happen after this pandemic is over.
And that those penalties to individuals are not evenly distributed across the population. And we see that certain families are going to be hit even harder by this, and it's going to be harder to re-enter the workforce, harder to get back to the same levels. And so when we think about, each relationship looks a little different. All families are all struggling with very different circumstances and different barriers. And that's why, keep going back to what Christy was talking about in terms of extending grace, not only to yourself, but to others, and recognizing that all of us come from points of actual resources that we do have, and being reflective of the fact that those are not equitably distributed across
not at all.
individuals.
There's one other thing I forgot to mention along that point that I think is really important, is making sure you're checking in with your partner about those tasks, because a lot of times we'll see with couples where in heterosexual relationships, the mother might say, yeah, it's not as equal as I would like, or it's not as equitable as I would like. And the dad would say, oh, I'm doing so much more now. Like I'm definitely contributing way more than I used to. And I think it's totally fair now. So those perceptions are really, really important. So checking in with the partner as well.
Yeah. I actually was there on Fresh Air yesterday on NPR that Terry Gross was talking about this study that came out of the New York Times, I think, or maybe it was the New York Times highlighted it. Yeah. But exactly what you're saying, when asked if, when asking men, are you doing equal amounts? About 45% say yes. When their female partners are asked, is your husband or male partner doing equal amount of work, 3% said yes. So there's this giant like gulf between what each partner is saying is maybe it's the definition of equitable, but maybe it's just that they're so busy during this, they're not checking in well enough with each other as to what we need to do to make it equal. So what you're saying plays out remarkably in the actual numbers.
And that's why I love this book, is it actually walks couples through all the different kinds of tasks that go on in their relationships and the level, because there's sort of an executive planning mode and then an execution mode. And if you're not clear on who's doing what mode and all that kind of thing, there's a lot of hidden tasks, labor that a lot of people, particularly women, end up picking up in relationships. And that leads to that perception of inequity. And does a lovely job of walking you through that.
On the podcast attached, we did an episode about this, and there's not just physical labor, right? There's cognitive labor. About what are we planning for dinner? It's not just cooking, it's all of the grocery store, blah, blah, blah. And there's also emotional labor, trying to like emotionally figure out. So the labor, like you're saying, is not just what maybe we traditionally think of as labor. It's like the actual physical sweeping of the house. It's the cognitive and emotional labor that takes up space in our day, in our ability to process other things as well.
Well, and I think to show that, to put another spin on it, because I think one of the things that sometimes when I'm teaching these topics and some of my male students are feeling, I'm doing the best that I know how. I think it speaks to the idea of socialization practices that we have in terms of having them brought into these discussions at the beginning, because sometimes what will happen is that, I think about my husband wanted to take my daughter to the class about music. And what is it called? The Mommy and Me class. And so I think normalizing that men are very much involved in these and want to be, and treating that as the expectation rather than simply the thing we're disappointed about and wondering, well, what is the etiology of it? How did that come about? It didn't come from nowhere, and really giving space to everyone to have a role. And, I think what Jeremy said is just checking in with each other to see, how do you conceptualize it? How do I? And I think that really speaks to, and I'm going to try and segue us into a question, because we're talking a lot about established couples, but a lot of this has to do with partner selection and thinking about that. And that may be changing right now. So without further ado, our next questions actually focus on that. For those who have not yet established a relationship and are looking, how has COVID changed the future of dating? And do you think, especially the role of social media in informing our dating prospects and experiences?
One of the things I've noticed is that a lot of people are starting their relationships with a lot of talking and a lot of, because they're not physically able to physically interact, or they're concerned about physically interacting for good reasons. And so I've heard, what I've been reading and hearing from couples is that they develop more of a friendship actually before the relationships kind of progress to the physical side, which is a kind of flipping things on its head. And I think that's a great change that I kind of hope we take back into the world, because I think friendship is a lovely basis for long-term relationships.
I also, going off that point, in some other interviews we've done with people that have been kind of navigating that world, that dating world during COVID, one of the things that people are also now not only talking more, but also asking more about like behaviors, like, well, what is your like health monitoring behaviors, like what are you doing? So trying to navigate that, which could lead to more, conversations about just people's general approach to the pandemic, and what their approach might be later on. So yeah, it has prompted this kind of different questions that are being asked, and different perspective as well, which is could be very, very beneficial.
Exactly. Yeah. Especially I'm thinking like even after we are not as concerned maybe about COVID, but maybe that new norm will help us talk about condom use and things like that.
Mhm.
It's often hard to navigate. Yeah.
And in terms of thinking about the effects of social media, I remember reading a fantastic, I think it was a book that was talking about the idea that it seems every generation has a new fear about some newfangled technology that's going to ruin the
Right.
formations of relationships. And then they went back and marked all of them. And so things such as, yes, the social media and the internet dating, but then they talk, the telephone is going to ruin things. People won't get together. The car is going to, make us all distant from each other and we won't be as connected. And so it helps kind of put that historical lens on it of saying that as we modify perhaps the ways we're connecting, it doesn't diminish or change the nature of that connection or what our needs are as humans to connect to others and feel a meaningful connection. And we recognize that that can be difficult. We appreciate all of you who are here on Zoom because we know that Zoom fatigue is real. And so we're trying to figure out this new normal, which leads us, because I wanted to make sure we tapped into one that has a slightly more optimistic air to it, is that as we prepare to go back to work and we prepare to envision a world in which we have a normal experience, again, whatever that is defined as, what adjustments can we start making now to make that transition as smooth as possible for our relationship, and I'll add on, and our relationships with others?
Cool. So I could start with this one here. One thing that I think is really useful is, so like we know from before the pandemic and then entering into the pandemic, like, right, that was a big transition for everyone, right? There's so much life disruption. So when we think about transitioning back out, I think one of the good things is thinking about what we talked about, like expectations, and really setting those, and not just falling into the comfort of like, well, we'll just go back to normal, right? Like it'll just be completely normal, because we've all had this lived experience now that will likely be in the back of our mind as we're transitioning back to whatever normal is. So having those discussions now could be beneficial versus intervening as we're transitioning, being like, oh, wait, actually, I want to do this differently, or so forth. So really trying to have those discussions now of what that might look like might be useful in trying to navigate or prepare for that transition.
Yeah, I really like that. And, there some things that we do in the pandemic that I've really liked, surprisingly. So thinking about doing an inventory of maybe there are changes that you've made that you really like and you want to try and hold on to. So for example, me and my husband have 2 small children. And one of the things I've liked about the pandemic, though sometimes it's hard, is, we started getting into a habit where every day after school, we are taking the kids to after school activity, this, that. We started really doing a lot of stuff, and having very little home time. We would come home, eat really quick. Sometimes we'd pick something up on the way home, and then straight to bath and then bed. And I didn't realize how like rushed things felt. And that's something in the pandemic, though there have been other stressors. I'm not saying my life is stress-free by any means, but that is one thing that I noticed that I hadn't been aware of during the pre-pandemic, that we were stretched very, very thin in regards to that. So that's something personally that I'm going to be mindful to try and carry forward, that we don't have to do every after school activity. We don't have to do all of these things.
That's a good one.
We can come home, spend more time at home, and just pick up one or two, a few things that we want to do. So whatever that is for your family, for your life, for your dating relationships, there might be something that you've liked. Maybe we were talking about dating. Maybe you do really, really like the more conversation before you go on to your first date. That's something you're allowed to hold on to after. the pandemic is over. So doing that type of inventory as we think about transitioning, I think is a really important thing to do.
Who wants to follow up on that? I mean, Patricia just did a beautiful job.
I think you
about,
both.
like,
I think both did. And I totally agree. I think, and I like.
Apparently, I nailed it.
Yeah.
Jeremy
You
did
both
too.
did. You both
So
did. What else can we
did-
have? Like, what do you like? Yeah.
And then what do you want to change? I think, not to be always the glass half empty, but what things are we really missing? And, one of the things that to come back to my previous point and everything, that one of the things that a lot of people have been saying that they really miss are strangers, which is not something in our day-to-day life we would think of, but I miss interacting with people and, just smiling and just being around individuals who are not the people I've made sure to, have a Zoom session with, or that are in my pod. And so it suggests that when we transition back, that we think about what are the kind of relationships we need to start cultivating again, because we've kind of wiped out entire swaths of our connections, right?
There's a great Atlantic article on that.
Yeah, I just saw that. And it's wonderful research, because it's really showing this idea that we have so many connections that actually support our close ties. They don't detract from them. The way we might have thought is that we only have so many resources and energy. And it was thought, so put all your eggs in the basket of your closest relationships. But this is showing that it can also bolster us. And, that little chat that you have with a colleague in the stairwell about some frustration is one less chat your spouse has to hear about your frustration, and they might, I'm not saying he would appreciate that, of course, but they might appreciate a little bit more diversity in terms of who we are turning to for support.
Yeah. Amy, I'm thinking about that a lot. I think there's a lot to be said about what you just said, because we are, and we should be, and we are designed to be, as couples, embedded in a network community. I mean, it truly does take a village, and it takes a village to raise kids. I remember at one point I was considering taking a job in Maryland and leaving my community here in Tennessee. And I talked to someone and said, go through your week and count up all the people that are involved in helping you get through the week with your kids and your family. And at the end of that week, I'm like, oh, no way, we are not being too dependent on my community. And we have lost a lot of that. And that's when I joke, we feel like we can't social anymore, because we're not having those kind of incidental kind of conversations, and it feels awkward and strange. But we do need those so much. And I think those are kind of the social lubrication that helps us get through irritations at work and irritations at home.
Great.
And so we need to find some way to build that back. But I think it's going to be awkward. I think not only preparing for what's going to be good, Jeremy, but also think like preparing ourselves that this is going to feel awkward. I mean, especially those that are introverts, like this is like ideal, right? I don't have to talk to a lot of people. This is fantastic. And then like, oh no, you mean I have to go out and start interacting again? Like for some of us, it's going to be hard. It's going to be a transition.
It will be. My sister and I often joke that in the past year, our social awkwardness, because we haven't had to be with people, has gone to like a 10. We're gonna have to relearn how to
social.
Not say what's exactly on the top of our head, how to like remember how to engage in normative social interactions. I'm joking, of course, but with every joke, there's 50% truth.
Well, it's funny. My daughter's going to hate me saying this, but so she's been doing virtual school too, and so she likes to drink those fizzy like seltzer drinks and just burp in the middle of class, because we're phones off and we're telling her like, you can't do that when you go back. You know that, right? So,
we'll make sure she doesn't get the link to this.
All right, good.
And one thing I will say is that, we're focusing so much on couples, and we're talking about people who are staying at home and reemerging. And one thing I hope we do take throughout is that we take back into the new normal when we reemerge, is that for a lot of people, they never had the opportunity to, go back and stay home and stay remote. And one of the things that I think has been so lovely to see is the appreciation for all the people on the front lines who are doing, our nurses, the workers at the grocery store, all the people who make our life, and thinking about the connections, that idea of strangers, but all those people who are making lives easier and safer for all of us. I hope we don't go back to just having it all blend into the background, all those things, but instead continuing to appreciate the things we see and the things that we oftentimes overlook.
And here's what I would also encourage. So a lot of us, we study couples, right? But couples, again, like I said, are embedded in communities. And the more that I do this work, I realize that even though I'm interested in individual couples, I have got to think about policies that affect our couples.
Mm-hmm.
A lot of these people that you're talking about that are making it possible for us to stay home, are there policies in place that actually support these families and allow them to be stable, allow them to live a good life? Like, what should be the minimum wage so that people can actually have a life that's free of just immense oppression and stress? And so I think, you know, if you care about families, we need to also think about policies supporting those families.
Yeah, the family leave policies, all
Exactly,
of
that
those things.
too.
Even
Yep.
before the pandemic, we know that the birth rate in the United States has been going down. And the research says it's not actually people wanting fewer kids. People want more kids, but economically they have fewer kids because they can't afford them. So thinking about that, and also there's some recent research that came out that number, the birth number, has plummeted during the pandemic even further. So thinking about what a policy level, what resources do families need to be able to flourish so that they can have the number of children that they want to have. So our society, children are our future, can continue to move forward. Exactly. It's a wonderful song, but also
if you don't care about the fluffiness of
head.
families, you should care about the economy, because we need people for our economy. I mean, you know, if you are just straight whole card capitalist, you still need to worry about this issue.
Well, and I think it leads us into one of the questions that I have access to in our Q&A. That was a point that you guys have touched on, which, because I know Jordan is probably in the background saying, I told her to switch at 12:40. So I am paying attention to that. So one of the questions that came through is, are any of you aware of whether or not more mental health support has been sought during the pandemic? If so, is there anything in particular, parentheses, outside of the pandemic, of course, that we are crediting this to?
So I do know that there has been an increased, anecdotally from therapists that we know, there have
the East Tennessee Mental Health Association has data in our region and stuff.
Gone up, but also thank you for that. It has certainly gone up, but also access to telehealth, or not even accessing telehealth for these behavioral health type of therapies has also increased. And what we also know, which is very fascinating about telehealth, particularly for mental health resources, is that there's a lot less dropout rate. So we see that people are not only utilizing telehealth, but they're more likely to show up. So allowing people access to telehealth is really, really beneficial for long-term mental health, because it's a lot easier to show up. There's a lot fewer barriers. You don't have to worry about childcare. You don't have to worry about transportation. You don't have to worry as much about getting off of a work schedule. So improving access to broadband internet throughout our entire country, I think, would be really, really important to ensure that that trend goes on. Also, I know that a lot of insurance companies have started to reimburse for telehealth during the pandemic. They weren't previously. So I think that's another reason why we see an uptick in that as well, because you can get reimbursed, providers can get reimbursed for that. On the other side of that, I know that a lot of therapists and mental health providers are experiencing a substantial amount of burnout right now, a substantial amount of additional stress, because in addition to the stress that they already have because they're taking on larger caseloads, they're also experiencing a lot of stress. Now, that's not to say do not utilize your therapist, but it's something also to think about in the future, that we need to not only make sure people have these resources to utilize, but also that we're taking care of our therapists as well, so they can continue to provide these resources.
Well, I'd love to follow up really quick, and then I definitely want Dr. Gordon to talk about it, because I know she's a mental health care provider. But thinking about the point that Patricia just raised about burnout among our providers, one of Dr. Robertson's colleagues, who's fantastic in the School of Nursing, Dr. Joel Anderson, is actually starting a study looking at burnout of those receiving these care practices, you know, the telehealth experiences, and that with our excitement about, you know, the telehealth, and you can do this all online, that Zoom fatigue is also going to spill over into these experiences as well. And so he's really trying to get into understanding. He's focused on caregivers as those with Alzheimer's and related dementias. And he's trying to understand the idea of, are we, have we reached a tipping point where what was really great initially at the beginning of the pandemic is starting to come with some burden, and how can we address that while still delivering it to a wider swath of the population? But I want to make sure that Christy has a chance to respond also.
I think that's a fascinating question, and I can't wait to see what he finds, because I know there's folks that actually really love it and some people that really hate it. And again, it just feels like there's almost everything I've looked at in this pandemic, and probably just in a world, like bifurcated responses. It's not the same for everybody. So I'm really curious about that. I think that I'm really with Patricia, though, this idea of what she made me think of is really how much we need to expand access. And again, like I said, that's the thing I've really gotten very passionate about, is we just, the need is so big, unfortunately, and the providers that we have, it's just not enough. And so one of the things that we've been really interested in is how can we partner with lay people to create, so if you can think about tiered steps of care, can we do widespread interventions that we could train lay people and volunteers and clergy and things like that to deliver in the community to reach a widespread people with early intervention type things? And what we found is a little bit of early intervention can go a long way, especially if it's delivered regularly over people's transition points. And so I would love if we could start to think about relationship health as public health, and start thinking about it from a public health perspective of how we can get more things out there. Mental health is public health. How can we get more mental health interventions out there, and then have tiered care for people to get more and more services? But if we could reach more people earlier, we may have less need too. So,
And
Right. Improving almost prevention care, not accessing these care services when we're at a mental health crisis,
Exactly.
when we're at a relationship crisis,
Yep.
trying to, like you use this metaphor a lot, like our cars, we do regular maintenance, we do
Yes, we
regular
do.
oil
Right.
change. We don't, unless you're me, you don't go into the car repair shop when all your lights start coming on. You're like, oh.
If you do, then you're in trouble.
Right. It costs a lot of money, doesn't it?
Yes, exactly. So let's do a tune-up. Let's do a mental tune-up. Let's do a relationship health tune-up every year, keep ourselves on track.
Right.
Well, and I'd love to kind of add in a question that I think relates to it, because we have a couple questions, and I want to make sure to get the person who first asked one. But we have, hello, and thank you for discussing such important topics. Why, thank you. That's a nice way to start questions always. I'm curious about your insights on how to address digital divides between adult children and their parents, in parentheses, access, knowledge of how to use devices, especially those who are not able to be visited in the immediate community while following COVID prevention, or who are out of state. And that really, why I wanted to touch on this one now is it really speaks to some of the things we're talking about, of utilizing telehealth and connecting via Zoom. That presumes a certain, not only access in terms of internet, but comfort with technology. Oh. Speaking of technology, Dr. Cantor, we've lost. So we're seeing in action to show us how challenging these technologies can be. So hopefully he'll join us again in a second.
So a couple of just like working ideas during this time period, thinking of children and their grandparents. It's those some grandparents are savvy enough to jump on Zoom or have access to high-end broadband access to be able to broadband internet to access that. We have to remember our other technologies. There are telephones. Even
letters.
Yeah, that's what I was going to say. Letters. My 7-year-old actually still writes letters, sometimes under a little bit of pressure from us, to her grandparents, and it helps her with her handwriting, but it also helps her connect with her grandparents, because she also talks to them on the phone and says, did you get my letter? And it's just a fun thing to do, an additional layer. So yes, technology is fantastic, but it doesn't have to be the only way we communicate with each other if we're out of state, right? We have telephones, we have snail mail. And, I've also heard of people driving, if you're only 4 or 5 hours away, driving and just like talking outside a window to one another. So trying to think outside the box, because it is so hard when we can't connect to the people we're so used to being being able to hug and embrace,
Yeah.
trying to find ways to still feel that social emotional connection to people that we might not otherwise have.
Well, and I think it speaks to not only thinking about your own family members, but within your community, there are people who are isolated from their families, and how can we support them? And it's volunteering, it's thinking about, you know, I have an elderly neighbor. I wonder if they have had someone just drop off something. And so it doesn't have to be only your kin. I think sometimes we focus so much on our family connections, but our community is much broader, and we can do stuff within the community to support each other. And know that hope that others are doing that in our older family members' communities as well.
Yeah, the Office on Aging is having a fundraiser called the Snowflake Ball coming up in March, pretty soon, but it's to support actually a companionship program for a lot of seniors who are isolated and really needing some support in that way. So I really encourage people to learn more about that service, because you're absolutely right. We need to take care of people in our community too. Hi, Jeremy.
We're going to give you the hard question one of these times right before you jump off.
Yeah, sorry, my internet's just deciding not to.
It's perfect timing. If you're talking about the importance of
demonstrating the problem with technology, yes.
You are showing why we should send you a letter at the end of today. We'll write you a letter about
This
how
was all intentional.
Okay, so I do want to make sure we get to another question before our time runs out. This is going to bring us kind of full circle. The hybrid model of working partially from home and some from the office seems to be something we may transition to at some point. What are some things that we can do now to begin to prepare for this model of working, both things relationally, but also personally? Great question.
Very good question indeed. I've seen a lot of people kind of talking about how they are enjoying working from home. So I think that potentially, and I know there was a lot of talk prior to the pandemic about these kind of flex schedules for people, and it becoming more popular, but not really a whole lot of people were embracing them. But it seems like the pandemic has taught us that a lot of people can effectively work from home. But also, as I think Amy and Christy were alluding to earlier, these kind of like missing strangers and conversations in the hall and connecting with people, we're naturally built to be social beings and social creatures. We know that having strong social relationships is actually like linked to our immune functioning and our long-term health, both physical and mental health. So I think what this person is saying about kind of like a flex schedule, depending on the person, I think could be very effective. But I think ultimately what jobs could transition to is opening it up to what is best for that person, having more flexibility in the work schedule, having more flexibility in how and where they work, depending on the needs of their individual employees, could be something that we know now works. So we could transition to that depending on the needs.
I also, before I get here again,
I'm wanting you to talk before we lose you.
Yeah.
I also, Jeremy.
I also think, and this is, you know, anecdotally, I've seen this with a lot of folks as well, is early on in the pandemic, working from home, people were kind of trying to get routines, trying to get some consistency and some predictability, and some people were able to navigate, like, okay, this part of the room is my work area, this part of the room is not, or whatever. And so being still conscious of that, of like, even if you have, you know, sometimes going in, sometimes not, still having those routines of what that's going to look like. And that kind of predictability could help with kind of de-stressing this, like, where, you know, unpredictability that might be the case if there's a lot of flexibility with work scheduling and where one is working.
Yeah, and I think having routines too. I started taking a certain time of day, I take a walk, and that is like my mental time to turn off my work brain and try to ease into my home relationship brain. So I think creating spaces, I love that, you're absolutely right, creating a space that is the workspace, and this is home space, is really important. And I think mental space, doing the same thing, is important too.
Jordan has hopped on. Are you kicking us off?
Yeah.
No, not yet. Not yet. This has been so great. And thank you everybody for the amazing questions. I just wanted to say we have 2 more questions in the Q&A right now. That will probably be all the time we have to answer those. And then I will come back right after those last 2. So we just had 2 more pop in there. So just want to let everybody know we have about 5 minutes to go through those last 2 questions. And then
I think we answered one of them.
One of them we did. Yes, you're right.
Okay,
Yes.
so what are your thoughts about how political differences over the events of the last months and or willingness for people and families to trust one another to follow public health advice consistently may be influencing trust within families in the pandemic?
Great.
That's a fantastic question. And I'd first just love to reference a couple of episodes we did of my podcast Attached, where we did explicitly talk about how to interact with family members with different political opinions and marital relationships, and some research that came out about partners that have different political opinions and how they were able to stay together for the past 4 or 5 years. And it really is that their foundation of their relationship is beyond politics.
Mm-hmm.
But to this point, especially with public health, you can always have a conversation, but and try to have those open conversations. And political conversations are particularly hard with family members if you don't have a firm foundation of love and trust and history. If it turns constantly into just attacking one another, that's not a healthy way to have a conversation. Try to build that foundation of other topics that you can talk about. But at some point, when it becomes a public health issue, it's okay to draw boundaries.
Mm-hmm.
It's okay to say, this is how things are in my family. And if you want to come visit us, which we would love for you to do, this is what our expectations are. Be clear about those is very important. And be firm. You don't have to be cruel about it. You don't have to be condescending or mean. They're just facts. This is how things are in my family. We would love for you to come visit, but these are the rules that you have to follow.
Well, and I want to piggyback because I was talking to a psychologist about this who may or may not have been my father. And he was pointing out something that I was like, well, that was a good insight, actually, is that whatever level of protection you deem for your family, people who are being more conservative or risk averse, you're going to think of as being paranoid. And
Mm-hmm.
people who are taking, who are more lax than you are, you're going to think of them as too lax. And what you have to kind of recall is that we're all at different places on this ladder, and you have to have this same grace and space for everyone, and recognize that we're all trying to do our best to determine what's healthiest for our family and what is reasonable given the various constraints and barriers we may have. And so reminding ourselves that there are people who are going to look at us and think you're being really paranoid, and there's going to be people who look at us and say, you're being way too lax.
Yep. And I love that, because what that does is it helps you be less judgmental of everybody's decisions. We're all doing the best we can. And all of us fall in some gray area between, absolutely never leaving your house versus like wide open and doing everything. Most of us are that gray spectrum, I think. And I love that, Amy.
Mm-hmm. I'll let him know that was helpful.
And you're passing it on.
Exactly.
But I also want to go back to the point I made earlier too about active listening, as Jeremy also talked about earlier too, is really listening to understand. Going back to the political differences, is a lot of times we want to argue our point, but what we may want to do is just slow down and start asking people why they believe what they believe. How do they come to that? Trying to understand why this is so important to them. Listen and being curious and compassionate and giving people some grace and not having to argue your point and just allowing them to be where they are. And what I found is really great conversations sometimes open up if you can come from that stance rather than trying to argue your point. So.
And it's okay if you're having a family gathering to make political conversations off limits too.
Yeah.
Some families in some situations, it always erupts into something. It's okay to make that off limits. You don't have to talk about that.
Boundaries again.
There's an excellent study out of Indiana, a sociologist, I'm forgetting her name right now, but she did qualitative interviews and interviewed women who their husbands they felt weren't doing enough of those protective things for public health measures. And it's one of the good things that the women talked about was it was really a burden on me. Like, not only am I monitoring my children now, but I have to monitor my husband as well. And so even just being conscious of, whatever my beliefs are one way or another, how is that influencing my partner, right? How is that influencing them beyond just like right or wrong, but like what is the undue burden then on them because of what I'm doing or how I'm behaving? Is just having that awareness can be really helpful as well.
That's great. Yep.
And now we'll turn it over to Jordan because there are many more of these fantastic podcasts spoiler alert, many more of these webinars in your future that may or may not be about podcasts.
Yeah.
Wait,
I was
are
going to
they?
say we're excited to bring Amy onto the team to start our promotional materials for the Office of Alumni Affairs. Yeah. No. Thank you all so much. I just want to first start by saying thank you because you all have just been fantastic. Thank you so much for all the insight you've offered. It's been super helpful to hear everything, and I know that with the questions and the engagement we've had with that into, it seems that our attendees think so also. So I just also want to say that there will be a recording that will go out either later today or early on Monday that will have a recording in there, and you'll be able to watch that and have access to that and share it with anybody that you'd like. So just want to say thank you again to our panelists. As Amy mentioned, we do have some more checkerboard chats coming up. Our next one is going to be on March the 10th. It is called Should I Start a Podcast? And so this is something that we are going to be covering. We have a lot of people that have expressed an interest in this. So we have some alumni who are going to share some of their expertise with a podcast that they have started and share that with us. So if you'd like to register for that, you can find that link on our website for our upcoming virtual events. So thank you all again so much for your time today. We sincerely appreciate it. Absolutely. Thank you all so much. And we will see you all soon. Everybody have a great weekend and a happy Big Orange Friday.